something that I was going to say was better than ever.
Better than ever is our
paying
ability.
bills is better than ever because you don't have to do anything.
Better than ever.
Is it better than ever?
It's better than ever because
I'm like, I'm gonna make everything better. It's gonna be
Absolutely is
awesome.
better than it's ever
Never
been.
be
Absolutely.
Because our,
Yeah.
like, we're gonna be thankful
Better
for
than ever.
things.
Even if you use so let's stay focused.
Yeah, better than ever.
I hurt. That's my story right now. Is I hurt, and here's the way it happened. So Friday,
You did the MRF 2 days ago.
I did the MRF 2 days ago, and Friday I was teaching my class at Hendrick, and I was like, I feel bad. I was like, my back hurts a lot, and my knee hurts a little bit. I'm just gonna take it easy next week. And then we have this young marrieds life group from church at the house on Friday night, and one of the guys is like, hey, let's do the MRF together. I think we should do the MRF. And then Chris is like, oh, it's so sweet that Luke invited you to do the MRF. And I was like, okay. And I woke up all night Friday night, and I just thought about quitting. And I was like rehearsing this speech, hey, I'm going to quit. We can do another workout or whatever. And I didn't quit. And we did it.
I would have quit.
We ran from my house. Over to the park, a mile, and then did all the
things.
Yes. And then we ran back. It was horrible. And it took a long time. And I talked to Bustos yesterday. He did, I'll tag him on this. He did pull-ups. He didn't do kips. He did real pull-ups, like 100.
I think with a weighted vest.
With a vest. Yes. With a vest.
Super impressive.
It is impressive. So
How many years ago did we do the MRF?
2019.
2019.
Yeah.
And I swore I would never do it again.
I know.
Because
And
I was sore for 3 weeks.
I know, and you
I
didn't.
have stuck to that.
And you didn't do it on Monday. And
No.
I'm good for probably, maybe forever.
Another 6 years.
Yeah, that's exactly right. Yes.
7 years.
Seven. Yeah. Can you believe that? It was 7 years ago.
7-year itch.
Yeah, something like that. So, well, Dr. Taylor Tidmore, welcome to the podcast.
Well, glad to
we're doing
be
this.
here.
Yes, we're doing this. It's incredible. We're doing this. Well, you just got back from, did you just fly in today?
I flew in today.
All right.
1 o'clock.
Jet setter. That's
Yeah.
incredible. And you got back to Abilene without incident?
Almost, yeah. I mean, we did sit on the runway for an hour in Dallas, so I think we were on the runway longer than we were in the air. But, I'm here, so.
What's bad for me is to start calculating if I would have beaten the airplane driving.
We probably would have.
Yeah, that's not.
But I didn't have to drive,
Don't do that math. It's bad math.
I know. Flying out of Abilene is risky.
It is
When
risky.
works,
It's nice.
Wonderful.
Yes, that's very
but
true.
There's a decent chance it's not going to work.
That's very true. All right. Well, let's start. How did you get to Abilene?
Well, I've got to Abilene twice, I guess.
Yeah.
First time was,
A few of us did.
yeah. For college, went to ACU. I mean, I grew up Church of Christ. I just felt like every kid from my youth group went to ACU, and it was just kind of like, that's what you did. So I didn't really think of a lot of other options. I didn't apply to any other schools. And luckily back then, ACU, I guess, wasn't too competitive to get in. So,
Sure. Right.
so yeah, I ended up there, met Heather, my wife. We dated 2.5 years, got married after college, then moved away for 4 years of med school and 5 years of residency, and then found our way back. My wife, Heather, grew up here, and when we were in residency, her mother took her grandmother in to see Gary Goodnight, one of my future partners, who was a ENT here in Abilene, and she just happened to mention when they were in there, she had a son-in-law doing a ENT residency, and so it's like, oh, I'd really like to talk to that guy.
That's funny.
Have someone join the practice at some point. And so I think it was my second year of residency. He called us up. And so every time Heather and I would come to Abilene to see her parents, would meet with the guys in the group and kind of got to know them. And after a year or two, they offered me a job. So it's kind of just a great opportunity and a good practice that sort of fell in my lap. Never really had to look for a job. And
That's pretty cool. Yeah.
Yeah, we were in Missouri for residency, and so that was great for 5 years, but we knew kind of wanted to get back to Texas where all of our family was. So yeah, that was 18 years ago. Hard to believe we've been here that long, but
18 years.
Yeah.
You don't want to stay in Missouri?
We actually did love Missouri.
Did you really?
Yeah, we loved our time there. We were in Columbia at the University of Missouri, so it was a really fun college town, and
that's cool.
Lots of cool outdoor stuff and 4 seasons, and so, we really enjoyed our time there, but it was, 13 hours from family. So found our way back to good old Abilene.
We don't have 4 seasons here.
No.
We have 2 seasons. We have summer and then not as much summer. Yeah. It's not quite winter. It's just not summer.
It's not summer.
Yeah. However, we've had the best May ever to me.
It has been great.
It's been amazing.
We haven't had 100 yet.
No. March was bad. But May has been amazing. So
rain. So yeah, it's been
I
nice.
know. It's been really nice. Yeah. That's incredible. So you were heading into ACU and you were already set on pre-med stuff. What does that look like?
Yeah, I think in high school I decided that's the route I wanted to take.
Yeah.
I grew up, my dad was a firefighter, and so on his days off, we mowed yards. So from the time I was in 3rd grade through most of high school, we mowed anywhere from 25 to 30 yards a week. And so I think that made me realize that I was not cut out for manual labor in my entire life.
You don't want to do that.
I needed to find a different career path. And then after my junior year in high school, I went on a mission trip with our church to Brazil, and it was a medical mission trip. And so got to work with several different types of doctors there. And I think that's what kind of confirmed it for me that, I want to do that. I mean, I think the funny thing now, though, is I look back at like deciding that and doing that in college, like my thought process did not go beyond the first day of medical school. It was like, I'm going to go to medical school and I'm going to be a doctor. But what that actually meant for my life, what that actually looked like, you didn't really think about that at that time. But
that's funny. So I teach college and I've noticed something that students come to college and you can start out, I mean, at smaller schools. At bigger schools, you have to apply into that school, into that college, so you get into the university, but you have to apply to whatever, business school, medical school. But they start out and they can say whatever. They can literally say, hey, what are you doing? And they're like nuclear engineering first semester. And then by the 3rd semester, you know what they are? They're comm majors. Yeah. And that's where I am. I catch all the pre-med people and then they end up over in my world. Yeah. But pre-med, you have to want it.
Yeah, you have to. Yeah, you can't. Well, you can't put half an effort into it. That's the word I was going to use.
You have to put whole effort. Whole effort. All right. Yes. So whole effort.
I was pretty motivated in college. I look back now. I was like, I probably should have had a little bit more fun in college. I was probably a little too serious. I guess it paid off. But.
Well, you're very good at remembering details. I will say that. Like when we would do workouts and I'm not paying attention and you are carefully paying attention. And I'm just like, I don't know what we're doing.
You have to be a little type A, OCD, detail oriented.
That's right.
To do what I do.
Okay. So you got to Abilene, you chose medicine or pre-med, whatever you call it. And then you're in, like, at what point do you specialize? What does that look like?
Yeah, you really have to decide your 3rd year of med school. Okay. So that's at the end of 3rd year, beginning of 4th year is when you start applying for residencies, and those are going to be specialty specific. And so
you get your undergrad, and then that's 3 years past that.
Yeah. Okay. So med school is 4 years. So really during your 3rd year of med school, you need to have a pretty good idea because you need to do at least one rotation in that specialty so they can write you letters of recommendation and all those sort of things. And so
how long is a rotation? Sorry.
Depending on the specialty, anywhere from 4 weeks to 12 weeks.
Oh, okay.
So, so going into med school, I thought I wanted to be a pediatrician. And then after my first year of med school, I spent a month with a pediatrician, and I realized I did not want to be a pediatrician.
Do not.
I liked the kids. Turns out, didn't always love their parents.
Oh, so, what's to me the scariest part of, pediatrician, the scariest part of that whole experience, I experienced it from the waiting room, is that waiting room is like, it's a scary movie. There's like screaming and diseases and I feel like
and snot.
I can feel the flu. I can just feel it. Oh yes, I can see the flu in the air. Oh, it's so bad. Anyway, but then I think they started post-COVID. We don't have little kids anymore, but they started doing it where you like wait in your car or something.
And they'd call you, or
that's way better.
Like one side of the waiting room would be for well-child checks, and the other one would be for all the sick kids.
I'm sure that works. I'm sure that works.
Yeah, the germs won't travel across the waiting room.
Non-smoking Denny's. Yes. Okay, so I didn't know this. So you wanted to be...
I wanted to be a pediatrician. But
pediatrician,
after my first year, I was like, I don't think I want to do that.
Yeah.
And so I decided, I think during third year, I wanted to do something surgical.
Yeah.
And I think different surgical subspecialties attract certain personalities. Like orthopedic surgeons are typically like, they were probably jocks in high school. Or, they probably played football. They lifted a lot of weights. And so, but I felt
just like us, right? Yes, like us.
It's shocking. I'm not an orthopedic surgeon.
Right.
But I think when I did my ENT rotation, I was like, oh, these are my people.
Oh, that's cool. Yeah.
Like we're all kind of tall, skinny, nerdy guys.
That's funny.
And so, and I really liked head and neck anatomy and ENT. You get to see adults and kids. You have surgical and non-surgical patients. It was a good mix. And so, I mean, you kind of make a decision not fully knowing what you're getting yourself into, but I mean, looking back now, it was a good decision. I like what I do. Yeah. Most days.
Yeah. So. This is just, I mean, you see stuff every day, but this is just like a teeny tiny little example. But last year at camp, there was at youth camp, there was a dislocation, a shoulder dislocation, and he's laying on the table. And I'm like, I did okay with that. And I do okay with lots of medical stuff. But, but and you and I have talked about this, but when bones don't go the right way, it's pretty gnarly.
Yeah. I feel like I can handle almost anything in medicine. That's the one thing I don't like. Is when bones heading in the wrong direction.
Yeah, that's pretty gross
to me. So.
Yeah, for sure.
So couldn't have been an orthopedic surgeon after all.
Yeah, after all. So you specialized, you started heading in that direction?
Yeah, so third year, apply for residency. I think I did 12 interviews at programs all across the country. And then it's like this match process where you give them your rank list and all the programs rank the candidates and somebody somewhere matches them all up. And then you get told, hey, you're going here. And so, I matched at the University of Missouri. So it was you do 1 year of general surgery, your internship year, and then 4 years of ENT. So, 4 years of med school, 5 years of residency. So,
some weird hospital dating system where they rank you and you rank them. And they're just like some app. It's like, hey, I don't know.
That's you hope funny. You match somewhere. And
yes, that's right.
Occasionally you don't, but luckily I did.
Well, that's good. Yeah, very good. And you liked it, I guess. You did it?
Yeah. Yeah. I actually did enjoy residency. Yeah, okay. I mean, it was a lot of long hours, but I think one of the things I loved about it was just the people I worked with. I had a really great group of co-residents who we still get together every 18 months now, a group of us. And so just good guys. And I mean, obviously worked a lot of long hours but it helped when you were with people you enjoyed being with and who were responsible and good guys. So
lots of pain and suffering with that cohort, I'm sure. Yeah, for sure.
Like when you pledge a fraternity or something, it seems horrible at the time, but then you look back at it like, oh, that was actually, there was a lot of good memories made.
That's
going
funny.
Through horrible things together.
So you came back to Abilene?
Came back to Abilene.
Yeah, came back to Abilene, as we do.
As
one does. Yeah, that's right. Lots of people, me included, back to Abilene. When we left, we were like, peace out. We are so out of here.
Yeah, and that was not definitely in our plan, but
yeah, for sure. Yeah. So when you and I started hanging out, that was like a long time ago. I feel like we didn't have as many gray hairs. We're so distinguished now, but I didn't know much about what an ENT does, but I didn't think about it, but I kind of thought it was like runny noses or something, but like little did I know. I mean, I think my understanding is anything like south of the brain and above the neck. Like what is your domain? How do you define it?
Yeah, I'd say above the clavicles, excluding the eyes and the brain and the spine. So, so there's a lot I don't do, but there's a lot I do in that area as well.
Yeah.
So,
yeah,
I mean, I think people think we just do tubes for ear infections and tonsils, but we do, thyroid surgery, head and neck cancer surgery, a lot of nasal and sinus surgery. Yeah. I mean, a lot of what I do is, like I said, tubes and tonsils, but I also do a lot of thyroid surgery. That's a pretty big part of my practice these days. So, I think we do more than most people think.
Yeah, for sure. One time we were talking about a home construction project, and you had just told me, like, I don't know how you described it, but what I heard was that you took apart someone's head and to get cancer, and then you put it back together. And I'm like, if you did that, you can put up a wall. Like, I promise you can put up a wall. You can do
My wife
this.
would strongly disagree.
Disagree? What? No.
And
you
I
can
will
totally
disagree
do
with that
this.
statement too.
I think you can do
I'm
it.
not handy around the house.
All
So
right.
I have other skill sets, but
All
that
right.
is not one of them. So
I have a student right now. She said you dropped by the ER last weekend or something
yeah.
like that. Yeah. So
Yeah.
anyway. Yep, that's right. Yep, for sure. So you specialized. You came back to Abilene. What's your favorite part about your job? Or, I mean, assuming that you do have a favorite part of your job, you do.
Yeah. I think that's a difficult question. I think there's lots of aspects about it I like. I think it's like just there's like these little moments of joy, like when you realize, oh, like you did make a difference in that, or you did make a difference in that patient's life. You know, whether it's like the little kid who hasn't heard for a year because he's had constant ear infections and infected fluid behind the eardrum, and he put tubes in, and the parents come in like, he heard the birds chirp for the first time,
That's
the
awesome.
other day, or, like I do diagnose head and neck cancer, and so the cancer patient who I diagnose a patient with cancer, I'd typically follow them along for 5 years. And so,
Wow.
get to the end of that 5-year mark and be like, hey, you made it, you
That's awesome.
you had a rough road, but you came out the other side. And so I think it's those, moments of joy. Most kids don't want to come see me, but there are the kids who want to give me a hug when they come into the room. So I think it's just those little moments where you realize, what you're doing hopefully is making a difference. So there's definitely lots of moments of frustration in between, but and I think I join the people I work with. So.
Yeah, that's awesome. So when somebody needs, none of my kids needed tubes. Because we're very strong people. I'm just kidding. I'm just
Incredible
kidding.
immune systems.
That's right. Incredible. There's a lot of kids who need tubes. What happens? Why do they need tubes?
Usually, this is a talk or a little spill I give all the time.
Okay. All right.
When kids get ear infections, they get infected fluid behind the ears.
Okay.
Or behind the eardrum. So sometimes you give them antibiotics and it clears up the infection, but doesn't necessarily clear up the fluid. So kids have a hard time clearing that fluid up. And so that fluid just keeps getting reinfected before they can ever get rid of it. And so, if that goes on for several months, they've been on multiple rounds of antibiotics, and that's when we put the tubes in. So there's a small hole in the eardrum. It prevents that fluid or source of infection from building back up. So usually if you get rid of that fluid and source of infection, you can break that cycle of infections.
And it drains it, I guess?
Yeah, so if they get an infection, it'll drain out through the tube, which is kind of gross. You get smelly, snotty drainage from the ear, but usually you can treat that with just antibiotic ear drops rather than antibiotics by mouth. So,
So one of the themes of this podcast is better than ever. And so if it was 100 years ago, what happens? What do people do if they get that?
Kids died of ear infections. You get something called mastoiditis, where that's mastoid's the bone behind the ear, where you can get a chronic infection in there. I mean, it could travel to the brain and get a brain abscess. I mean, kids, could die of those things 100 years ago before antibiotics and before ear tubes, so it seems like such a simple procedure that we do all the time, but it really does prevent a lot of long-term complications, and or a lot of people lost their hearing because of chronic ear infections that were never controlled. So, yeah, definitely better than it was 100 years ago.
Stephen King, in one of his books, it's a autobiographical book called On Writing. Have you ever read this?
I haven't read that one.
It's really interesting, even if you're not interested in writing and just his process and everything. But I think it's in that book that he talks about how he had an ear infection and the only thing they knew to do back then was just like pop the eardrum.
Yeah.
And
I used to lance little kids' eardrums in the office, hold them down and stick a little knife and make an incision in the eardrum and let that infected fluid drain out. So we do it. We do it in the operating room now. They get anesthesia gas to drift off to sleep. So it's a little bit more humane than it probably was when Stephen King was a child.
But that's
probably one of his core memories, because
I know.
it's one of the things you don't forget.
I know. Oh, I know. And I wonder why you're writing all these horror stories, sir.
Yeah. Someone stuck a knife in your ear when you were a small child.
the amount of pain, wouldn't that be like wildly painful?
Oh,
Or you
extremely
pass out?
painful. Yeah.
Oh my gosh.
Yeah.
Okay. Well,
I
I think
mean, yeah.
about that story a lot.
Yeah. I need to go read that book.
Yeah,
So,
yeah, for sure. Okay, so that's your favorite part, like seeing people through. That's really cool.
Yeah. I mean, there's lots of good aspects of my job, but I think it's those little moments where, people express their appreciation for what you've done. So.
Yeah. How do people visualize your day? Like, what do people think about your day? Where you're like, yeah, it's not quite like that, but I don't know. People never ask about being a professor. So, but surely people ask about being a physician.
Yeah. I mean, I think there's parts of the day, that people don't realize. I mean, like the hours a day I spent just documenting, visits and op reports and charting and calling insurance companies to get things, approved, whether that's a surgery or procedure or imaging. So I think there's those parts of the job that aren't, super glamorous that people don't realize,
You're calling the insurance company?
Yeah.
That sounds horrible.
Yeah, you have to do it. It is horrible. It's usually called a peer-to-peer. So I'm speaking to another physician who works for the insurance company. Oh. And usually I'm speaking to like an OB-GYN who knows nothing about ENT, but she's approving
sounds really fun.
The CAT scan that I ordered. So it's typically a extremely frustrating process. So, but I think, those are the parts of the day that are less glamorous that people don't think about.
Yeah.
I think the part of medicine that I didn't realize before I went into it, and I think a lot of people probably don't realize, is just, I think there's just, every job is stressful, but I think there's a different level of stress when what you do affects someone's body. I mean, that's their person. I think there's something holy and sacred about our bodies. And so, I think a lot of decisions we make have an outcome that affects someone's body. And hopefully most of the time those outcomes are good and positive, but if you practice medicine long enough, you operate enough, there will be bad outcomes. And I think there's just an underlying level of stress that comes with that, that every time you walk into the OR, you walk into an exam room to see a patient, there's that thought in the back of your head that, what I do, hopefully doesn't, but could have a negative impact on this person. And so I think the longer you practice medicine, the less that anxiety and worry becomes, but it's always there. So I think that's, that's an aspect of medicine that probably most people don't think about, when they're watching ER or something like that.
Yeah. I wonder, I mean, in a job, like a regular job, it's a bad deal when you go to work every day and you're like picking things up into your backpack or whatever, where it like accumulates. And so, but you're saying for you, it's kind of the opposite, like where you don't carry it as much anymore, or what is that like? I mean, is it weighing on you?
I don't think as much as it used to, I think used to there'd be surgeries like the night before I wouldn't sleep well because I was nervous about that surgery the next day, and I think after doing this for 18 years, I feel like I'm definitely a better surgeon than I was 18 years ago. I feel more confident and comfortable in my skills. And so, I think it's definitely there, but it's not as intense, I guess, as it once was, but it's always there. That thought, that if I mess this up, it can have really catastrophic effects for someone.
Yeah, for sure. And you're on call. You go to the ER often, right?
Oh, yeah. I mean, I take call every fourth day, basically. So, and luckily for ENT, our call is not typically bad. I definitely don't go in every time I'm on call, but I feel like when we do get called, it's a lot of times it's a big deal. We do a lot of airway. So if there's an airway emergency, we're the person that's called. And so it sounds silly, but we get called for nosebleeds. I mean, people don't think nosebleeds are a big deal, but people can die from nosebleeds. I mean, you can have a really severe nosebleed that you can't stop. And especially people like are on blood thinners and on call, we drain neck abscesses. I mean, it's luckily I'm not doing that every time I'm on call, but we can see some fairly emergent stuff that has to be taken care of. So.
Wow. We don't have tubes in ears, but we do have nosebleeds in my family. We do have some nosebleeds, but I don't really.
Could be one of the more frustrating things we deal with. So
I've only gotten like 3 nosebleeds ever, I think. But so what do you do? Do you have to like surgically do something?
Well, usually when your nose is bleeding, it's bleeding from the septum or the middle part of the nose up front. So sometimes I can see where it's bleeding from, and I can cauterize it with silver nitrate. It's like a little medicine on the end of a stick.
Okay.
If I can't see it, sometimes you have to put a pack in someone's nose, like basically like a tampon for the nose. Yeah. You stick in there and stays in there for usually 72 hours. People love having that in their nose. But sometimes if neither one of those things work, occasionally I'll have to take people to the operating room and like use a camera endoscope to look into their nose and find the bleeding spot and cauterize it or pack it off. So, yeah. So nosebleeds can be extremely frustrating.
Wow. Yeah, I think it
can be scary for patients. Yeah. You know, when you have blood pouring out of your nose.
Yeah.
You can't get it to stop.
Used to bleeding from your face.
It can be fairly traumatic. So
I read that book. I think it's called Breathe. It was really good, but he does this one thing where I think it's for a few days. He gets his nose packed just to like not breathe through. He just breathe through his mouth the whole time. And that sounds horrible. Yeah. That sounds super horrible.
Not many people do that on purpose.
No, it sounds really bad, but it's a great book. Like it sounds dumb, but I enjoy breathing through my nose after that book. Like there's some exercises you can do and things like that. So
we're made to breathe through our nose. That's how we're supposed to breathe.
Yeah. Sometimes I get a little judgy when I'm at stores and I see people breathing through their mth too much. Don't you know? You're supposed to be breathing through your nose. You know this, right?
They have mouth tape for that now.
Yes, that's right. I thought, have you ever done this at night?
No.
But people are doing this. I feel like is it dangerous? Like you're going to, I don't know, like die or something. Like
I haven't heard of any reported deaths from it yet.
No deaths.
I don't think I would. I wouldn't like that.
No, I wouldn't like that at all. No. However, I am considering getting a sleep mask. It just for my eyes. It just sounds nice.
I think like a CPAP mask.
No, not yet. Oh. No. When you see me with the lines on my face, then you'll know. Yes. Oh no. So, toughest part of your job that it affects people's bodies? What is that like? I mean, or you're literally, you know what's frustrating about being friends with people like you, is that you can check your phone anytime because it literally is life and death. Sometimes at the gym, there's a cardiologist or somebody, and I'm like, I can't check my phone whenever I want because it's never life and death.
I don't know. A gift and a curse, I guess. Sometimes I feel like
I'm just kidding.
I can't just turn my phone off.
Yeah,
at night,
for sure.
Especially if I'm on call. So.
Yeah, for sure. Yeah.
Yeah, that could be frustrating.
Yeah.
And so funny.
Yeah.
Sometimes like I'm not wearing my Apple Watch. I have a different watch on, but I still feel it vibrating. I'm like, I'm not getting a notification. Like, it's just crazy how we're so
they say like
in tune with our technology.
They say that's like a condition where you feel like your phone's buzzing and it's not buzzing. You don't even have it in your pocket.
Yeah.
It's crazy. Yeah.
I think one hard part of my job, this may sound like I'm complaining a little bit, but it's like, I think as a physician, you always have to be on.
Yeah.
Like when I'm in the operating room, I have to do a really good job every time.
Yeah.
And I'm seeing a patient, like I have to be constantly engaged, listening really well and being kind and empathetic and compassionate. And there are days when I'm tired or there's things going on at home, where it's really hard to do those things. And I fail at it sometimes, and so there are times when I'm not as probably kind, as compassionate as I can be, especially with a difficult case or a difficult patient. So I think that's a difficult part too, is just like feeling like you have to be on all the time. So
your family, you have 4 kids and I have 4 kids and they're kind of in the same universe and the same stage of life. And they're just doing all the things And they're like, this one's going this place and working this and doing this and this and this and this. And I look at my wife and I'm like, dear Lord, please help me listen to what she's saying, because she's saying so many things. I'm just like, I don't know what she's saying. And so but you have to listen, right? You have to.
You have to. And sometimes I struggle with that. I get home, I'm like, I need no one to talk to me for 30 minutes. I can answer no questions.
Yes.
I can make no decisions for the next 30 minutes. I've answered a lot of questions, made a lot of decisions today, and I need a 30-minute break.
Yeah,
so
just need a second.
My family doesn't always love that, but no, they're very understanding.
That's funny. Yeah. Have you seen the meme where it's like, the wife says, are you even listening to me? And the husband says, that's a weird way to start a conversation. I think about that a lot. Don't you remember that we have this concert this night? I told you. And I'm like, I don't know. Did you tell me?
We've had that conversation many times in my house.
Yes.
My wife's like, I told you that. I'm like, I have no recollection of
I'm
that
gonna need
conversation. I'm sure you did.
A receipt of when you told me that? Yeah. All right. So a procedure that used to be really bad and is not that bad anymore?
Yeah, I think, like I said, I do a lot of thyroid surgery.
Yeah.
And that's, you're opening someone's neck and removing a gland. And there's a nerve that runs under the thyroid called the recurrent laryngeal nerve that controls your vocal cords. So if that nerve is injured during the surgery, people can have temporary or permanent change or hoarseness to their voice for the rest of their life. And so,
wow.
So like I said, that's, definitely don't want to do that to someone. And so I definitely remember like doing a thyroid on my own for the first time, like that's like a core memory for me.
I bet.
So stressful because in residency, you're always operating with an attending physician or a teaching physician. And usually there's another resident with you. So you at least have another couple other doctors in there with you who, can kind of guide you, or you can ask for advice, and they know how to retract and they know what instrument you need. And so all of a sudden, like you're on your own and you're trying to figure out, how to teach the scrub tech, how you want, things handed to you, how you want the tissue retracted, and trying to figure that out on your own. In the beginning there's a steep learning curve to that. So I think, doing some bigger surgeries like that, like I said, I would definitely lose sleep at night the night before those things. And now I don't, after you've done hundreds and probably thousands at this point in my career, there's like I said, just a level of comfort and confidence in your skills. So it's nice to be at that point in the career.
It's like this way. Where is it? In the thyroid.
Your lower neck.
It's here.
Yeah.
Oh, down here.
Yeah, down here.
I thought it was like up here. Okay.
No, so like I said, I have an incision on your lower neck.
All right. Oh, interesting. And so you've been doing this for 18 years. Is there anything that, like when you first started, and not just that was hard for you, but just like overall, it's just gotten so much easier? And the thing I was thinking about is, I think I was one of the first ones in the area when I got a laparoscopic appendectomy. Mm-hmm. That it used to be this huge, horrible thing, and now it's just like not that big of a deal, outpatient.
Yeah. I think in residency and medical school, you're taught like the practice of medicine, like the very scientific part of it. I don't think you're really taught what I call the art of medicine, which I think I've learned over the last 18 years. I guess what I mean by that is like when a patient comes in, what are they wanting out of this visit? Like, what is their expectation?
Yeah.
Because everyone has different expectations when they walk into the room. You can have two patients with the same complaint, but they may want totally different things out of that visit.
Yeah.
I can have two patients walk in with the complaint of hoarseness. Yeah. And they've had a rough, weak voice for 6 to 8 weeks.
Oh, wow.
And one of them wants you to do everything you can do to get their voice back to normal. They love singing. They want their singing voice back. Well, the other patient, their dad passed away 6 months ago of vocal cord cancer. And they just want you to tell them they don't have cancer. They don't care what their voice sounds like. And so I think that's, just when you walk in and meet a patient, just reading their demeanor and their responses and just kind of getting a feel for what do they want out of this visit? How aggressive do they want me to be? Are they interested in medical treatments or surgical treatments,
Yeah.
And so I think there's an art to that you develop after, you've been practicing for many years.
And add to the mix, how many minutes do you have with them?
Yeah. Usually
long.
not many.
Not many. Yes, not many.
So,
And you probably are trying to make them feel at ease in a very few a very few minutes.
yeah.
Yeah.
Yeah, that's tough,
Yeah.
So, and like I said, once again, that's something I think I've improved on over the years, so.
Yeah.
And now that I'm part of a big medical system, patients can review you after every visit. And so patients are pretty brutally honest. So it's a tough pill to swallow sometimes, and you're like, oh yeah, they're right. I probably wasn't great at that visit, so that makes you better.
Have you seen that? Surely you've seen that meme where it's like, what does it say? He saved my life. It's four stars.
Yeah.
And the doctor comments, I honestly don't know what else I could have done.
Yeah, I don't get that fifth star.
Yes,
I don't
a
know.
fifth star. Yes. That's great. Yes. I mean, I get reviewed too every semester, not public. Well, I mean, I guess kind of publicly on Rate My Professor, Rate My Prof, but yours is different because it's literally with their body and life and death kind of things. Yeah, for sure. And sometimes I'm like, what do you want? The class is great. What do you want? Yeah. So a big thing that I think about and look at is media stuff. And so what movies and TV shows get it right? Where you're watching something, you're like, yeah.
I think I've avoided a lot of
medical
dramas and movies over the years. Just like, oh, that's what I do all day. I don't want to be entertained by that.
Yeah.
But a movie I think us and everyone else in the world has watched The Pit over the last year. And I will say, not that I've watched a lot of medical dramas, but it is pretty medically accurate. Like I'm pretty impressed with the job they do. And I think what I really appreciate about that show is especially the first season, I feel like they did a really good job showing just sort of like the emotional side of being a medicine, and especially kind of the toll COVID took on healthcare workers. And just, I think COVID's kind of in the past now and we forget that, but I think, it still has a lingering effect on a lot of doctors and nurses. And so I think The Pit did a really good job of sort of honoring that aspect of the profession. And I think they did a pretty good job. I mean, there was a few things that I was critical of, especially when it came to some airway emergencies, but overall they did a good job with that. But my daughter, I think, watched every season of Grey's Anatomy, so I'd occasionally walk through and be like, that is that's not the real world.
That's not real.
It's a lot of drama, a lot of soap opera, but I did appreciate The Pit, and I feel like they did a really good job.
So I've been teaching for a long time, and Grey's Anatomy was on, and there was a character on Grey's Anatomy called Dr. Bailey. And I just didn't appreciate that. I just did not like that because especially my female students would be like, "Oh, Dr. Bailey, you're on Grey's Anatomy." No. What? Yeah, on The Pit, it feels like they're always trying to trach people. They're like,
there's a lot of trachs.
yes, I know. Like, relax.
I think that is the one thing about that show. I think they condensed probably 6 months of the most exciting ER cases into one 12-hour shift. But it makes for good TV. And I mean, I'm sure a major trauma center in a big city like Pittsburgh or Dallas is different than the emergency department here in Abilene. But there's definitely nonstop interesting cases on the show.
What, from your vantage point, what's dangerous? If a friend was doing something, you're like, professionally, you're like, yeah, don't do that. Because my wife is a nurse, Krista's a nurse, and sometimes she's like, she was stressed by putting people back together. Or, people are breaking things, and then she would have to try to fix it or whatever.
Yeah.
And so I don't know if you feel that way. I don't know.
Oh, there's not a lot. There's not a lot of things. I'm like, oh, don't do that.
Don't do that.
I mean, I avoid Q-tips.
Oh, no Q-tips.
No Q-tips.
Do not do
I'm against Q-tips.
Okay. All right.
Wear hearing protection. So
Yes.
if you're shooting guns,
Yeah.
if you're using AirPods, probably don't turn it back up 50% full volume.
Yeah.
So I mean, it's just kind of nerdy things like that.
I have cheap AirPods because I don't trust myself to get the fancy ones, but I bring them with me almost everywhere. And I just, because they're the rubber tipped ones, I pop them in. Like at church, I put them in just so that I'm not.
You don't have to listen to the sermon.
No, I do listen to the sermon, but it's just so loud. And I don't want to be that old man, like it's too loud, turn it down. Yeah. So yeah, I feel that way with murder podcasts and murder stuff. I'm like, my life is sad enough. I don't want to dive into, like you're viewing medical shows or whatever. Yeah. And then, so Grey's Anatomy, they don't really.
Actually, I haven't really watched a lot of Grey's Anatomy.
Don't watch it.
I think the last medical drama I watched before the pit was ER, and that was in the 90s, and that was really before I was into that field. And so I don't really remember whether it was accurate or not.
Yeah.
So
that's funny.
A lot of people love Scrubs. I think that was during when I was in med school. I just didn't have time to watch a lot of TV. So I don't know. I haven't listened to a lot of that.
Yeah. And Scrubs was funny, but it was also really serious and kind of stressful sometimes. Yeah. It's kind of weird. Yep. What about technology? Like, is AI coming for everybody's job? Is it coming into your world at all?
It's entering my world. I mean, I think especially the good thing as a surgeon, like AI can't do that. They can't operate on someone. Yeah. I mean, I do think of like radiologists or pathologists who just look at images all day or slides all day. Like AI can do a pretty good job at that, and so I think it'll be interesting to see how it affects those fields. I mean, there's a lot of software now where like AI is listening to your whole visit in the background, and it will basically document the whole visit for you, from the history to the exam to your assessment and plan. And so I actually trialed it last week. I think I'm a little too OCD. I like my notes a very specific way. And so I didn't love it because I feel like I was giving up control, but there's that aspect of it definitely.
It's just text or it's audio?
It's listening. So like there's an app on my phone. So when I enter the patient room, I hit record. And so it's listening to my entire visit, my entire conversation. It is actually pretty incredibly accurate. I have several buddies in other cities who are using it and absolutely love it. Like they won't go back. And so I think you'll see more of that and that as it gets better, it will save physicians a lot of time. I mean, just because we spend so much of our day documenting visits. And so there's an app I've been using called Open Evidence. It's kind of like Chat GPT, but for medicine. So
really interesting.
Basically, they've loaded every journal article and textbook into it. And so it's really nice. I mean, things that used to, I'd have to go, what textbook is that in? Go find that textbook or find that journal article. And now it's just like you type your question into this app and it's going to bring up the latest articles and evidence. And it's just right there at your fingertips. You can bring it up while you're in the room with the patient. And so
that's pretty cool.
That's I started using that probably 6 months ago, and I really do like that. So, I mean, there's aspects of AI that will be beneficial, but I think there's aspects of AI that just can never replace what a person does, so at least not yet.
I was in college. I think about this story a lot. It's real weird. I don't think I've told you this story. And I had a sinus infection or something. And so the nurse comes in and he's going to give me a shot, but he pulls a book off of the shelf and like reads a few pages, like he's like is referring to something. And then he closes it and then he gives me the shot. And I'm like, what are we doing? Like, I don't know what's happening right here.
Shouldn't you know this?
What are you reading? This is really weird. Anyway. And then, like how close are we to a bot being able to do a thyroid surgery?
Yeah. hopefully not close.
You're very vested in this.
But I
You're
do
13
think of,
years.
like family practice or internal
Yeah.
medicine where, what they're doing is listening to problems and it's not procedure oriented. And so
Yeah.
I do feel like, I don't know, there may be a role for that with AI someday, you
Yeah.
know, I don't know, but it wouldn't surprise me
Yeah.
at the rate AI is developing. So, so anyways, there is robotic surgery, but it's driven, by a person on a console,
Oh, yeah.
but it's mainly abdominal surgery. It's hard to stick a bunch of ports into someone's neck. So not too much robotic surgery going on in our area yet.
Yes. That's so, okay. So like that thing that's listening to your appointment.
Yeah.
Can you listen back later or is it just transcribes it?
It basically just transcribes it. And then I think once I'm finished and it transcribes it and puts it into the, computer note, then it's deleted. So it's not like a permanent part of the patient's chart. But there is like a note on the bottom of the chart that says part of this note was generated using AI. And we are getting consent from patients so they know that AI is being used, during their visit. So one of my partners, I think he's going to use it. Like I said, I'm not convinced yet, but so.
And so what you could do is that if they come in a year and they're like, remember I told you, and you could pull it up and you're like, actually, you didn't tell me at all. Let the record show, buddy. I'm sure you've thought about this and there's probably a huge body of literature about this, but it's weird to me that you have to rely on me telling you what's wrong for you to find out what's wrong.
Yeah.
And so I think the day when medicine circumvents that, where you don't have to rely on my description of the things for you to fix my things, it's going to be huge.
Yeah.
So like a blood panel or a scan or like a really, really fast scan. So it's not a CT scan, but it's just like really fast. And like I would go to a separate facility and then do my scan and then I would meet with you.
Yeah.
And that would be amazing.
Yeah. I mean, obtaining a good history from a patient can be extremely challenging.
Yeah.
And I mean, a lot of times you have to continually redirect the patient or ask the same question 3 times. And then especially if they don't speak English and I'm going through a translator and then trying to like discuss some complex medical issue through a translator and not really knowing what the translator's saying, can be even more challenging. So I really feel that with like my patients who come in who speak Spanish, or we have a lot of Swahili speaking patients in this area, and so that becomes, incredibly challenging.
And there's probably patients who come in who want like a 2-for-1 and they're like, my nose is messed up, but also like my elbow hurts. Could you help? Could you help my elbow?
I try to end every patient visit was like, do you have any more questions for me today? And that's kind of dangerous at times. It's like, I want to make sure that patient got everything out of the visit that they wanted. But sometimes you go, while I'm here, and then you go down another, 10-minute conversation. So.
No. Do you have any more questions for me?
related
for
to
me,
this
related to
topic we've
this
been discussing
that I take care of right now?
Yeah.
That would be hard for me.
So.
It's interesting to me that you go to all this school, all the fancy school, and then you like sometimes the people that you're interacting with are just like not taking care of themselves, or it's a broad range of patients for sure. Yeah.
Yeah, for sure. I think we see people from all walks of life, and so I think that develops a lot of empathy. When you, I think it's easy when we live in our little worlds where whether it's just hanging out with people our kids go to school with or our churches, and it's easy to forget there are a lot of people in this world who don't live like you do, and a lot of people with lots of challenges and get into difficult situations. And so, I think we get to see that every day, and it's a good reminder of, I don't know, how other people live and the blessings you have. So.
Yeah, for sure. Yeah. You got any books? What book should we read? I didn't tell you about this question, but is there a favorite book that you have? What's a book? I feel like you're always reading.
I'm always reading. The book I can't stop thinking about, I think is one of your favorite books that I just read was 11/22/63 by Stephen King.
Yeah.
I just read that a month ago, and that's stuck in my head.
And you finished it?
Yeah.
Did you read it?
I did actually read it.
It's forever.
It's like 800 something pages. My kids are like, I can't believe you're reading a book that big. It's like, it can be done.
Yeah.
I think my favorite book of all time is a book called Cutting for Stone by Abraham Verghese.
Okay.
It's fictional. The author is actually a physician, but it's the story of twin brothers who are from India but grow up in Ethiopia, both become physicians. They moved to America to practice medicine. So my youngest daughter's from Ethiopia. So I was reading it around the time we were going through that adoption process. I think it just like combined Ethiopia, which is a big part of my life at that point, and medicine. And so it's a great story, really beautifully written. And so that's probably one of my favorite books. I've read it. Maybe 3 times.
Really?
So, yeah.
Wow, that's very cool. Yeah. And then, is there anything you want to plug? You're on the school board also. I did not mention that. I know you got to go in a second, but you're on the school board, and I didn't know all the things that school board members have to do, and I applaud you for doing that, and I feel sorry for you. So both of those things, I'm thankful.
I signed up for
I'm thankful that you're doing this.
Yeah. No, yeah, I've just almost completed my second year being on school board, and I really have enjoyed it. I've always been a big fan of public education. My kids have had a great experience in AISD, but I definitely have a new appreciation for public education and our teachers and our administrators and the struggles that public education is facing. So, I think it's good work. I think it's important work. I have enjoyed doing it.
Nice.
Send your kids to AISD. That's my plug.
That's your plug.
Yeah.
Public school. All right. Anything we didn't cover?
I'm sure there are things we didn't cover.
You'll have to come back.
Yeah.
So, well, Doc.